Yes, good morning again. Now, as we have explained the introduction to the anatomy, trying to explain what is the anatomy, now I can further get into the treatment and the injection therapy that we do here for different diseases and the symptoms. So first we will talk about the epidural steroid injections. So why do we do epidural steroid injection? Again, they're done for neck pain, back pain, mid-back pain, degenerative disc diseases, radicular symptoms such as pain going down your arms, neck, going around your chest, for herniated discs. All of those, basically, we do epidural injection. Again, different patient and different anatomy requires different type of injection. Like I always say, not every injection is an epidural injection. This is a concept that a lot of our doctors' friends do not understand. So this is an educational video for everyone, that not every patient that walks into our Arkansas Spine and Pain Clinic will get automatic epidural. So we will go further into different injection and explain why, and then once we examine the patient, we see the MRI, we will decide which patient requires what type of injection. So today, right now, I will start with an epidural injection. What is an epidural injection? Epidural injection, just like I said, are done for back, neck, herniated disc, radicular pain, and they're done different approaches. There is something called intralaminar epidural injection, which is basically we put a needle under the x-ray guidance, which is called fluoroscopy, through these two bones into the mid intralaminar. So it goes right in the middle to give pain relief, deliver basically steroid shot into the back, so or the neck or the mid back, depending on where the patient pain is. Now, that is called the intralaminar approach. Again, these are all done under x-ray guidance. So we're putting the dye, we're making sure where the medicines to be delivered, and they're done, majority of them done under sedation, very low conscious sedation. Now, if a person's having a one-sided pain, leg pain or arm pain, just right or the left. Now, according to the nerve roots, we can do an epidural through these holes that I have discussed, because these are the nerves that come out of these holes. So we can deliver medicine right where the pain is coming from, according to the nerves. Then the third approach is called a caudal epidural injection, which is an injection, again the steroid injection, through the tailbone. Now, why do we do that? Mainly for patients who've had back surgeries and had a lot of fusion scar tissues, we can do a caudal approach. And it delivers medicine very nicely, especially from S1 nerve roots to L5. So we'll get the both side, both leg, down to your foot through this approach. It's the oldest technique for epidural injection. Now, there are other injections through the caudal that you can also do, such as patients who had scar tissue in this, you can put a catheter through the caudal approach and do epiduralysis to relieve some of the scar tissues. Now, that is a very good procedure that can relieve a lot of back and leg pain. Now, going further after the epidural, we have other type of injections, such as we will go to joints. So patient comes back with comes to us with mainly buttock pain or hip pains in the back, and after exam we decide that they have an SI joint pain. So again, like I discussed before, the SI joint is between the hip bone and the backbone, the tailbone. So we will deliver medicine right into this joint called the SI joint. Again, done under X-ray. So that way we know where the medicine's been delivered. Now going further up from the tailbone, you see these are the facet joint that I have discussed on this model. These joints, again, like I discussed, they can cause a lot of back pain especially when we put load to these joints. Now again, a lot of patients come to us with just mainly back pain, not leg pain. And depending on exam, we will do something called a facet block. Now facet block is called a medial branch block. So if you ever hear that word, that means we're going to block the nerves that go to these joints, such as this nerve or small nerves. These are very small nerves. They are not the nerves that go down your leg. These are sensory nerves in the back, and we will deliver under X-ray numbing medicine to these nerves, and the patient is expected to get pain relief very temporarily for a day or two maximum. The reason is that we're just trying to identify the problem at this time for which joint is causing the pain. So we do multiple joint blocks because each joint is supplied by two nerves. So we have to block few joint nerves. Once we block them and the patient goes back home and have a pain diary, and they can write down how much pain relief you got during the day or two. And then the patient comes back to the clinic and talks to us, explain us that she or he had a good relief. Then we will do another block to make sure 110% that this is what it is. If two blocks on each side gives patient relief about 70 to 80%, then we will proceed with something called radiofrequency nerve ablation. Now, radiofrequency nerve ablation is the next step, which can give you pain relief for several months to years. And what it does, we use a special probe and special machine to basically do radiofrequency on the nerves that we have blocked. These are the nerves, again, go to the joints. And they basically die or burn. We burn them through radiofrequency. Again, the procedure is a little longer than the blocks, but also it is more of a long-term solution than a temporary block. But the radiofrequency only happens once we have two positive, good blocks, and then we can further proceed with the radiofrequency. Now, other procedures that we can do on a regular routine are, again, epidurals in the neck. Just like in the back, the needle goes through two bones into the intralaminar approach to relieve the pain. Same thing will happen for the blocks in the neck. These are the small joints. We will block these nerves. They are right here under X-ray. Now, let's say we're done with these procedures and the patient only got 50% relief and still continues to have back and leg pain, and they've had back surgery or neck surgery. So our next step, after consulting our neurosurgeon, and if they are not willing to do any more surgeries and the patient has scar tissue, has again numbness, tingling, and our own pain medication, but they're not happy, then we can do something called spinal cord stimulator trial. Now what that is basically where I inject based in, again, it's a procedure, a full sterile procedure where basically we poke 2 needles into the spine just like an epidural, but actually put this wire in your back. Now what is this wire supposed to do? Basically these wires have electrodes on top right here. So I move these wires up to the thoracic area under X-ray guidance, and we turn these electrodes on, and we work through a computer to basically find if you get pain relief in your legs or arms. There are different types of sensation from what you are getting or the patient gets from the pain. This is again a totally different sensation. Now it's supposed to go back to the brain and changes the pain pattern of pain signals. So that's why patients get pain relief. So we will do a trial. This is called a spinal cord stimulator trial. For a few days, patients get to go home with this, and a remote is given to them, so they go and work through that remote. There are different programs are taught to the patient how to use them, and if you really like the sensation and the pain is better, you're able to sleep better, you're able to function better, then you come back after a few days. We take the wires out, and then we refer you to our neurosurgeon friends who actually implant these in your body with a small battery implanted in your buttock area. It is just like a pacemaker. So it's a small battery, and you can charge it yourself, and the wires are all inside, and there's a paddle lead in the middle. So this is all inside, like regular small surgery. So this way you can have a good pain relief. Now there are other procedures such as pain pump. So let's say this don't work, then there's next step is pain pumps, which we can also offer at Arts and Sweat Spine and Pain. We can do the trial, we can refill the pumps. Now we also offer different type of peripheral nerve blocks, such as for failed knee pain. If you've had knee surgery, if you had knee replacement, and you continue to have pain, we do something called genicular nerve blocks. And we also do that under X-ray, under fluoral guidance, and patients tend to get good relief out of that. And then we can also do something called radio frequency to those nerves, so your pain goes away for long term. We have the other like occipital nerve injections we do for headaches. We have different nerve blocks for different problems in the whole body. So this is just a little bit rundown of what we're doing procedure-wisely, and we still can do a lot more, such as prolotherapy, and we're also doing something called plasma-rich platelet therapy, which is the upcoming natural way of healing your arthritis pain, where we take your own blood and spin it in the special machine, and we take the growth factor out of your own blood and inject it back into your knee or your joints, so the cartilage can grow back and you can avoid the big surgery or big knee replacement or shoulder replacement or hip replacement. These are the new upcoming techniques and which we're using. And combination of these techniques with physical therapy can really help the patient, and that's why we're here to help you to relieve pain. Please, if you have any questions, we're available anytime to answer your questions. and you can come see us at Arkansas Spine and Pain. Thank you.